Hi friends, this is Dr. Serkan Balta. I'm a plastic surgeon working in Istanbul, Turkey. So we already talked about the BBL, but everybody has some concerns about the BBL, and they're right. BBL is not a safe procedure only by itself. It has some techniques and it has some special precautions that you have to take care. It's not about you, it's just about your surgeon. So liposuction is usually safe if you just stop in same amounts, if you don't take so much fat. But when you're transferring the fat to the Botox, it can be dangerous. So what causes this danger? There is a special vein. It just collects the extra, it just takes the blood outside of your bum and it takes it through to your lungs. So it's a very wide and thick vessel. So in this surgery, if you harm this vessel, and if you just enter fat just directly inside this vein, so it takes all the vein through to the lungs, so it's going to be mortal or dangerous. For plastic surgeons, we always like muscle. The muscle is a very oxygenized tissue, so it has good blood supply, good vessels, and very high levels of oxygen. So if you transfer fat inside the muscle, you just increase the rate of the fat cells they're living. So in the other tissues, in the chest wall, in the other sides, we always love the muscles, but in the Botox it's so dangerous. When people started first with this BBL transfers, they always choose inside the muscle because it was so oxygenized, it was having a good blood supply, and we thought that the fat will survive in that site in a higher rate. But then everybody learned that it's so dangerous because of that special vein. So for us, how to make a safe BBL, the first thing is we know where that vein is. In most of the patients, it's in standard positions. We know the position of that vein. So we always don't want to give harm to the vessel, because it doesn't mean that you only just enter the vein inside and give some fat. You can also harm the vessel, and the vessel itself can suck your fat inside itself. So it's also dangerous. Do not harm that vessel. So in order to not to harm that vessel, first thing we have to do is don't use the muscle plane. We are always over the muscles. In this way, maybe in the future you can have a second session of BBL, because the fats does not survive as much as in the muscles, as in subcutaneous tissue. So we are going a little bit far away from the muscle, and it makes less fat viability. So you can need maybe second or third session, but it's going to maybe save your life. So we never choose directly inside the muscle fat injections. Second thing is we always use blunt cannulas. They're not so sharp, they're blunt. It's not so easy to damage a vessel with a blunt cannula, and it's also so important for us. And for me, I always use power assisted devices. They have a vibration system, and they always give the fat in different areas in little amounts, and it doesn't push so much fat in one side. So if you just go with a large amount of fat injections, it can also have a possibility to go that fat cells through to the vein. So just stop in somewhere when you're giving fat, give safe amount of fat, use safe plane, use safe cannulas, and choose the right patient, because if you don't choose the right patients, you can be in trouble with the patient and with the BBL also.